Good evening, and welcome to the Omega Psi Phi Fraternity Incorporated 2nd District Health and Wellness Monthly Webinar. I am Dr. Keith Boykin, your host for the evening, your moderator for the evening. I am a retired pediatrician and internist. I hope everyone had a great holiday season and a very, very good New Year so far. We're glad to be back at what we do monthly for our communities. As usually, our webinars focus on prevention, education, and information for our communities, but everybody is welcome. First, I got to say that the opinions expressed here are solely those of the individual person speaking or presenting and do not represent those of the Omega Psi Phi Fraternity Incorporated. Now, tonight we have some very important topics to discuss, but before we get started, I want to give each brother an opportunity to do some opening remarks. And we'll start with our chairman of this committee, Dr. Jedan Phillips. Dr. Phillips? Are you there, Dr. Phillips?
I'm here.
Sorry for the little technical difficulties.
Yeah,
I'm sorry. Go ahead,
apologies for the technical difficulties. Still here at work. Just finished up with my last patient of the day. But again, just happy to be here with everyone talking about these important issues. Again, the message that we're trying to convey each month is a message of prevention, because as we've said many times, prevention when it comes to your health costs you a whole lot less than reaction. So looking forward to our conversation this evening, and good to see you, Big Bro 78. All right.
All right. Okay. Is Dr. Wingfield in the house? Did you make it in, bro, Wingfield? Okay. I'll come back to him. Dr. Isabell, won't you give us your opening remarks? Oh, there's Dr. Wingfield. Go ahead. Sorry about that.
I'm live. Good evening. Good evening. Thanks once again. This is, as always, a pleasure, honor to be here, ready to exchange information. Hopefully everyone can hear me here, but interesting topic, great need for this discussion that we're going to have tonight. So looking forward to it.
Thank you. Go ahead, Dr. Isabell.
Good evening. Thank you for, sorry, having a little technical difficulties. There I go. I could, good evening, Dr. Lee Isabell, good for the discussion that we do today, the webinar. Thank you.
All right. Thank you so much, Dr. Isabell. Dr. Plummer? I know he's here, Dr. Plummer. All right, let's see if Dr. Ford's here.
All right.
There's Dr. Plummer. I'm sorry.
All right. Happy New Year, everyone. My name is Dr. Plummer. I'm a board-certified OBGYN, and I specialize in fetal medicine. I try to do the discussion about women's health, and we'll have a very good discussion on the topics for today.
Okay, thank you, Dr. Plummer. Dr. Ford, were you able to make it so far? I know you were trying to get on. Is Dr. Ford on? If not, we'll come back to him later. So let's go ahead and get into it. You know, we talk about awareness and prevention and information to our communities. And just what happens, we talked about this in a previous forum, but this month is Cervical Cancer Awareness Month. So I want to spend a brief amount of time talk about that, because we have 3 other topics I'd like to get to tonight as well. But briefly, we want to talk a little bit about cervical cancer. So I'm going to hand it off to you, Dr. Plummer. Why don't you tell us a little bit from your perspective? We have the other brothers chime in as well. So.
All right. Well, cervical cancer is like the 4th most common cancer worldwide. Usually about 600,000 women are diagnosed with cervical cancer worldwide, and about 342,000 deaths worldwide. In the United States, though, it's documented to have about 11,500 cases documented in the United States, and about 4,000 deaths a year. Why? Is because the United States is because of Pap smear screening. Okay, now cervical cancer is pretty much almost 100% early detected and also prevented can be prevented in the United States with routine pap smear screening. Right? Now, usually the first time the pap smear screening is usually about 21 to 25 years of age. Pap smear screening can be started at that time. And another thing that also has helped decrease the cervical cancer rate is vaccination for HPV, which are the most common causes are usually 16, 18, and 33, which are the most common HPV that can cause cervical cancer. So with routine pap smear screening starting at age 21 to 25, starting at age 21 to 25, and then usually around every 3 years or every 5 years until you get to probably about age 65, if you have no abnormal pap smears or anything that can stop, or if you have a hysterectomy not due to cancer, then cervical screening could be stopped. But the whole thing is to follow up with your gynecologist, especially at the age of 21 to 25, and at least get your first pap smear. All right.
Thank you. We're going to pause here a moment. Dr. Ford was able to join us now. Dr. Ford, would you go ahead and give us your opening remarks, please?
Yes. Good evening, everybody. Just wanted to say thank you for having me again. It's always a pleasure to come and be amongst the bros and give some good information out. I think we have multiple topics this evening and looking forward to sharing the information.
Thank you, Dr. Ford. Now, Dr. Plummer, you talked about, screening. You talked about things, particular what they need to do, ages and cutoffs and things like that. But I think you talked about one important thing that I think that we need to embrace and especially in the African American community. That's vaccination for it. So I know that probably all of the doctors out here, including myself, at some point in time have recommended the vaccination for us. So let's talk a little bit about that. In your private practices or in your scope, what do you brothers do? What are you saying? What information are you giving to people about the HPV vaccine? So anybody can take that question.
Well, as a primary care physician myself, and I do women's health and women's preventive health, again, I also discuss advocating for the vaccination because, number one, vaccination can play a major role in prevention of cervical cancer, and that can be not only in our female patients, but also, as the recommendations indicate, they recommend it for young men as well, because it also can help them in preventing some ailments as well. So I understand, we've got vaccinations are a hot topic as we've come out of the pandemic. So what I try to do is just really attach people to the Vaccination Act and the things that it can prevent, because I think a lot of people are not aware of the benefits of the vaccine. So I try to do it in that way. I, will be somewhat of a pest if they say no the first time. Hey, you think about it, and that's usually the way that I go about it. I find, I'm sure that all of us can attest, when your patients trust you, even with their, hesitancy, they will, follow along with your recommendations. So I think, again, as we've talked about with the COVID vaccine, understand where people's apprehension is coming from, educate them as far as the benefits and the information pertaining to this vaccination. I know a lot of people are very concerned with the HPV because, there's been some data that wasn't necessarily correct, but it tried to make it seem like this was some type of experiment that was being planted in communities of color. But again, we look at these cancers that we're talking about, cervical cancer, penile cancer, those can occur in our space because of our lack of utilization of preventive services. So that's one of the strategies that I use in trying to get my patients to be comfortable with taking this vaccine.
Dr. Isabell, you had something you wanted to add to that?
Yes, to add to that, originally when the vaccine came out, it was for a certain age, I think up to age 26, but now you have patients asking between age 26 and 45, it's also been giving. And I even have some patients that are probably older, like 46, at the doctor's discretion, they may ask for it. But I noticed over time that has changed, and there are patients, some have asked me regarding that. And as we know, the HB, the 16th and the 18th, those are the highest one that increased risk of the cervical cancer if they have those. Also regarding, I do HIV primary care, and the screening usually is different, where it usually stops at age 65, but in HIV or in body immune compromise, they recommend lifetime, because for some reason HIV patients have a higher risk of development if they get cervical cancer, it can progress fast.
So, folks, you heard that we it's something that was important that we need to be aware of. I mean, even I'm sure you, Dr. Ford, you have a fair amount of people in your practice you have to deal with too that need to be aware of cervical cancer and maybe be referred to a place like that. What is your take on it?
Right. So definitely cervical cancer, but also there's other cancers. There's anal cancer, throat cancer, so multiple other cancers that it can prevent. And so this is just one of the things that we have in our armamentarium to help far as prevention is concerned. Especially we're talking about, people have different sexual practices that, you want to help them to stay healthy and prevent them from getting other cancers.
Thanks.
So definitely we're promoting it, and not everybody, I think what Dr. Phillips said, at their primary care, sometimes you have to tell them several times. They may not catch it the first time. That next year when they come in for their physical, you want to hit them again with it. So just being persistent with trying to get them to get the vaccine.
Thank you. I think a lot of people fail to realize the importance of it at some time. That's why they don't ask about it. They don't think about it because they think it won't happen to them. But as we said here for our audience, that this is cancer, cervical cancer awareness month. We want to make sure everybody's aware of that particular cancer. And as my brothers have told you, that the vaccine is very good for preventing it. As a matter of fact, there was a study done that showed there was a significant decrease in the amount of cervical cancer in the Black population with the advent of the HPV vaccine. So please think about that, getting the vaccine done, and at least discuss it with your primary care doctor. And if your parents out there, even though your children are not supposed to be having sex, as you say, but they are. And so make sure you have them get their vaccine as well. The vaccine will not cause them to be promiscuous. It has nothing to do with that at all. It's only a preventative vaccine. It has nothing to do with the mental aspects of people. So please don't think about the HPV vaccine as something that promotes sexual promiscuity, because it doesn't. Now, we had a good discussion on that so far, but let's turn our attention to something else, another important topic in our community, and that's thyroid disease. A lot of people don't know a lot about thyroid disease, or they think they know about thyroid disease, and they probably heard somebody talk about the term goiter. So one of the brothers would just tell us what is the importance of thyroid health and some of the things that we experience in thyroid disease. We lost Dr. Ford.
Well, again, let's look at what does the thyroid do. The thyroid regulates your metabolism. So again, an overactive thyroid, which is a thyroid that's causing an over secretion of thyroid hormone, can cause things like palpitations, can cause sweating excessively, can cause abnormal weight loss, can cause abnormal GI function. And the interesting thing when you think about thyroid disease is that because a lot of these things could be attributed, you're just anxious. It can be a very frustrating process to getting a diagnosis, because a lot of times the symptoms can be associated with mood-related symptoms. And as we've talked about many times, mental health issues isn't always our community's forte. An underactive thyroid can cause basically symptoms of you feeling like you're slowing down. You feel cold a lot. You can feel fatigued. You can notice changes in your bowel habits, such as constipation. You can notice dry skin. And this can contribute, it can cause some weight gain. And this can contribute to other conditions such as cholesterol abnormalities. So again, the thyroid can affect many other aspects of our function. And it is something as a family doctor that I'm checking on a regular basis as far as questions and probably a blood test to evaluate thyroid function. Now, there's some circumstances that can become particularly concerning as far as the possibility of developing a thyroid issue, such as women who are pregnant. Sometimes they can have problems with their thyroid after pregnancy. In addition to that, if a person has an abnormal immune reaction, possibly an immune reaction to their thyroid gland, that can cause an excessive secretion of thyroid hormone, which can cause thyroid abnormal symptoms. In addition to that, if a person's had their thyroid removed, that can unfortunately lead to you having to deal with thyroid issues and being monitored and managed with medication for the foreseeable future. So the thyroid is something that can affect a lot of different areas of our body. And unfortunately, it can also mask itself to people that may not be great at going to the doctor as, you know what, you just stressed out, you depressed, and unfortunately, we've already discussed that mental health issues aren't the ones that we follow up or get evaluated on an aggressive basis. So this could be something that a person could sit with. I had a patient who I diagnosed with an overactive thyroid, and she had been walking around for a few years, friends, family, all talking about, you're just stressed and anxious all the time. You don't eat right. And when we did the workup, it was quite clear that she had a thyroid issue. So again, it is something that can affect you in a variety of ways. I see Dr. Isabell looks like he wants to add. Go ahead, Dr. Isabell.
All right, to add to the thyroid, where is the thyroid located? The thyroid is located here, midline the neck. Doctors sometimes palpate in the front, or they palpate it standing in the back and have you swallow, and they palpate for any nodules. So think of your thyroid is involved. It's a hormone, but it's involved in metabolism. And metabolism, think of the thyroid as a battery, because say if it's overactive or underactive, or even it affects metabolism. It can affect your heart, where it can make your heart beat too fast, can beat too slow. It helps in metabolism of certain things in the liver, the food that gives you energy throughout the whole body. So if the thyroid's off, like brother Dr. Jedan Phillips said, you get all these side effects. And one thing I like to add, that, for example, underactive thyroid, where you see your doctor, what tests do they do? Like they do the TSH, which is the thyroid stimulating hormone test. So usually if that's high, then it's usually a sign of underactive thyroid. Some confusion, people think, oh, if it's high, my thyroid must be overactive, but it's actually when it's low, when it's overactive. Then you have what you call subclinical hypothyroidism or overactive thyroid. Is, for example, if your TSH is a little less than 10, you may not have any symptoms at all, and then they may do you need medication or not, or I may just watch it. And usually they recommend if your 10 or high, but I know some, depending on providers, some may start it at a lower level. And one important, a lot of patients I find out, they don't realize for underactive thyroid that you're supposed to take the, like the Synthroid or Levoxyl pill on an empty stomach, because taken with other medications, it affects the absorption and it's hard to regulate the dose.
Yeah, I heard two major areas that brother Dr. Phillips and brother Dr. Isabell talked about, and that's cardiac, and that's probably going to be some significant manifestations in pregnancy as well. So before I get to you, Dr. Plummer, let's hear some about the cardiac manifestations of thyroid disease from Dr. Wingfield. Are you there, Dr. Wingfield? Are you there?
Yeah.
Okay.
Hopefully I'm clear. I really have a really bad connection. What I tend to say when it comes to the thyroid gland is the thyroid is the great masquerader, okay? Because it can exhibit all types of symptoms, from palpitations to weight loss to constipation to diarrhea. So from a cardiac standpoint to elevated cholesterol. So from a cardiac standpoint, we do screen thyroid function when it comes to blood pressure. I have younger patients who present with high blood pressure in their 20s and 30s. That can certainly be related to issues with the thyroid. Elevated cholesterol, issues with the thyroid gland. Those symptoms of palpitations, atrial fibrillation, all of the pushed by issues with the thyroid gland. So certainly that's something that we focus on from a heart standpoint and across the board from a medical standpoint. So again, the great masquerader, it can present with anxiety, stress, palpitations, heart manifestations, etc.
Thank you, Dr. Wingfield. Dr. Plummer, tell us about thyroid in pregnancy, because I know it's a very important thing to deal with in pregnancy, having had kids that were born to mothers of thyroid disease. So tell us a little bit about manifestations of thyroid and pregnancy and pregnant women and just women in general. So
well, usually the first way we find out there's thyroid disease is usually infertility. So when a woman is missing her period or is not able to get pregnant, one of the things that we do screen for is their thyroid. Now, if they have thyroid issues and it's not controlled, either hyper or hypo, it causes an increased risk of pregnancy loss. Plus, hypothyroidism can also increase the risk of preeclampsia and elevated blood pressure in pregnancy. One of the good things is that most of the medication is supplementation or medication to help reduce the amount of the hyperactive thyroid can be taken in pregnancy. And one of the things that we also look for is those antibodies can also go across the placenta that stimulate the thyroid hormone and can also stimulate the thyroid hormone in the fetus, which can cause a fetal goiter. So that's one thing, the importance of taking your medication to help reduce the hyperactivity of the thyroid when you're pregnant. But most of the time, it's usually more hypothyroidism is more of the issue, and they can take their thyroid supplementation and really have very successful pregnancies.
Thank you. In my world, when the mothers have not managed their thyroid well, sometimes we get a baby called what's called a cretin. These babies are overweight babies. They have a characteristic facial, but their tongue kind of protrudes out, and these babies have problems with eating and metabolism problems. So if you have a child out there and you're pregnant and you want to make sure that you manage your thyroid disease with either your OBGYN or your primary care doctor, because I hate to see them come to me as a pediatrician when it wasn't well managed. So with that saying that, Dr. Ford, take us through your aspect when you see somebody with suspected or known thyroid disease.
Right. But one of the things too that I think we just talked about hypo and hyperthyroidism, but other things that we talk about are thyroid nodules. Okay. And so, doing a good exam. Dr. Isabell mentioned how you examine the thyroid gland, but a lot of times we may feel a nodule or multiple nodules on the thyroid gland, and that has to be investigated. 40% of the population actually has thyroid nodules, but not all thyroid nodules are malignant. Actually, it's a very small percentage, about 5% that are actually malignant, meaning cancerous. But we need to work it up, and by working it up, we need to get a blood test. We also talked about that thyroid stimulating hormone that will assess whether whether a nodule is overactive, underactive, not active at all. And that will determine what type of workup we would actually do on that particular patient. If the patient's TSH is very low, which suggests that they have a overactive thyroid nodule, then we would do what's called a thyroid scan with uptake, and to try to see if that's a hot nodule, and that would be treated differently. And most of those are benign, not cancer, so you wouldn't really even go about trying to biopsy those. But if you have someone that has a TSH that is normal or the TSH is elevated, then that's when we do an ultrasound to try to see whether that nodule is a solid nodule or a cystic nodule, right? If it's a solid nodule, then that's when we would consider, depending on the size of the nodule, the shape of the nodule, different characteristics will determine whether you want to do a biopsy of the nodule. And once you do a biopsy, then what they basically kind of grade it to see, what's going on, whether it's precancerous, whether it's low risk of cancer, and then that determines how often you want to go back and actually revisit that nodule. Because if it's cancer, obviously that's something you're going to go refer to a surgeon, and they're going to remove the nodule or remove the whole thyroid. But if it's not cancerous, we still have to follow it, because sometimes even when you do, we have to follow it. Not sometimes, we have to follow it, whether it's in 6 to 12 months, depending on what the cells look like when you do the fine needle biopsy.
That's very, very interesting. I forgot about that aspect of thyroid nodule. I had a good friend of mine who had I don't remember if she had a nodule or what. She went and saw someone, and they kind of didn't do a whole lot for her, but she saw a subsequent person, found out that she did have a thyroid cancer, and she got it taken out, and she's doing very well now. So it's important, folks, that you follow through with this stuff. What we haven't talked about here, though, is thyroid eye disease. You see all those commercials out for thyroid eye disease. These people with these protruding eyes and dry eyes and red eyes and things like that. So that's another important aspect of thyroid disease, is thyroid eye disease. I'm not sure if any of you guys have seen it in your practices here, but people need to be aware of thyroid eye disease as well. So that's a good segue for our next topic, and that is glaucoma, another very, very important topic in the African-American community, because we are at risk for glaucoma. And I think I'm going to ask Dr. Isabell to tell us what are the risks for glaucoma. What do we need to worry about glaucoma for?
Well, the reason we have to worry about glaucoma, because it can affect the optic nerve, and the optic nerve is what we need to help us see vision. So a lot of people usually don't have symptoms at first of glaucoma. They can have a high normal pressure and not know slowly that the fluid that we call in the eye, the aqueous fluid, pressure is going up and putting strain on the optic nerve. Sometimes people may get symptoms of headache, nausea, and not realize it, or redness of the eye. Normal pressure is usually between of the eyes between 10 and 20. A lot of times patients do not see their eye doctor or get their pressure checked. they may just go to a store, their vision's changing, and they just may get reading glasses, not knowing that it's a pressure problem. It's higher for some reasons we don't know 100%, but some say in African Americans, is it because the cornea is thinner? But that's subjective. But is that the reason why it's higher in the African community, or is it access to seeing ophthalmologists or optometrists? Personally, we should also know family history. It can affect anyone in the family. For example, personally in my family, my son, he's only 17. He was recently diagnosed with, glaucoma. His side effects, he would get these headaches, feel lightheaded, and brief episodes of blindness. So we took him to the eye doctor, and we knew his pressure was high. And I said, is there glaucoma in my family? Come to that, I didn't know my grandfather had glaucoma. You think you don't know all your history, you ask your parents, but then they bring, up that a family member. It's also noted on my wife's side. So everyone personally, I've been affected with glaucoma.
So you bring up an interesting point there. And I'm gonna come to you, Dr. Ford. You bring up an interesting point there. You said that family history. So if you have a family history of glaucoma, then you're at risk for developing it. My sister, she gets her pressures checked regularly, and they won't come out and call her glaucoma yet, but they say her pressures are on the borderline, and so she takes drops and things like that. And you talked about red eyes. That's why I was brought up thyroid disease, because is it red eyes from thyroid disease, or is it from glaucoma? Is your headache from something else, or is your headache from glaucoma? Those are important things to know. Now, there are other risk factors. I think you wanted to talk about that a little bit, Dr. Ford.
Well, yeah, definitely. One thing I definitely wanted to stress, though, was talk to your family, right? We don't always get family, our parents don't tell us what's going on, or your siblings. So that's so important to know that someone in your family has glaucoma, and Dr. Isabell just mentioned his son. My mom just last month complaining of headaches, complaining all these things. He mentioned that the upper limit of normal of eye pressure is 20. My mom's eye pressure was 60.
Wow.
And so she had emergency surgery to try to relieve the pressure, which helped her to save her vision. But it was just good that we knew to bring her to the doctor. But it's so important to know your family history, so that now I need to know. I just made my eye appointment again. I was a little over a year, but to know that, so I know what to do, and my children will know what to do also. So I think that's so important. Yeah.
Go ahead. I was going to say, Dr. Isabell shared about his particular problem. I know Dr. Plummer and I were talking beforehand about some of the issues that can cause glaucoma later on in life. The normal risk factors, if you're African American, is if you're 50 or older, or if you're Hispanic and you're 65, or the normal risk factors. But Dr. Plummer and I were talking before the show about another factor that could affect you glaucoma down the road. But if you mind sharing a little bit about that.
Oh, no problem. Actually, I had an eye injury in the 1970s. So trauma to the eye can also cause an increased risk in glaucoma.
Yeah.
The important thing is that you need to, especially if you have hypertension, a history of trauma, diabetes, you need to see and need to get your eye examined. And the eye examined is really not looking to see if this one is better, this one sees better, or this one is better. You need to have where they dilate your eyes, they're able to look at your retina, and is able to also to take your pressure. A lot of people are apprehensive about people looking in their eyes. There are people apprehensive about anything coming anywhere near the eye, but the most important thing is your eyesight. I mean, it's one of the most important senses that we have, and it's a very delicate sense. So you need to be on top of it and need to go to the eye doctor regularly. And that's one of the things with the prevention that we've always been doing day in and day out is definitely prevention. And this is the simplest thing that you can do. If you don't have access to an ophthalmologist, or your optometrist doesn't want to dilate your eyes or look in the back of your eyes, then you definitely need to make an appointment with a clinic or whatever that has an ophthalmologist that can do a full ophthalmology exam.
Your primary care doctor could definitely help you set that up. So again, take advantage of that. And I think one of the things that Dr. Plummer said that is so important is regularly. So that means that just because you went once and there was no problems, don't mean you go back again, especially in the circumstances where you have a history of hypertension or a history, more importantly, of diabetes. Because a lot of times, people go the first time, but they fall off with their follow-up appointments down the road. And unfortunately, when you fall off on that, and I think, a lot of falling off has occurred over the past couple of years because of the interruption caused by the pandemic. These problems that may not have been, noticeable, you wait 3-4 years, now we've got a situation that we can't turn around from.
Right. Yeah, because we're trying to prevent you from going blind. We're trying to prevent you, as Dr. Isabell said in his opening comment, was that it affects the optic nerve, and you only get one pair of eyes. They don't grow back, they don't regenerate, so you got to take care of them. And to that end, for our older folks out there, anybody that's on Medicare will pay for glaucoma screening once every 12 months. So if you're on Medicare, you can automatically get free glaucoma screening. So I think you should take advantage of that if you're on Medicare. And you can find out more information about glaucoma and other things at medicare.gov. So say, for instance, someone comes into your office and you suspect they have glaucoma, or in your case, Dr. Ford, your mother had very, very high pressures. What would be some of the recommendations you would do to them? Would you tell them that they need to see an ophthalmologist right then and there, or whatever? They say my vision is poor, I got headaches. What would you guys tell them the next step to do if you're thinking glaucoma? We talked about it a little bit, but I want to make sure people understand what they need to do if they come to see you and we're suspecting that they have glaucoma. Anybody?
I've had this scenario. I'm sorry, Dr. Ford. Go ahead, sir.
I was saying that someone that comes into the office who you truly suspect has that, as the primary care physician, I would try to expedite the referral, right? I wouldn't have given them a referral. Oh, you go call someone, call an ophthalmologist. No, get on the phone, call, try to get them more urgent appointments, because time is of the essence if their pressure is really that high. Yeah.
Were you going to start to say, Dr. Phillips?
No, Dr. Ford covered it.
Yeah. So there, and it's beyond the scope of this discussion, but there are two types of glaucoma that people need to be aware of too. So, when you see your doctor, make sure you understand what you got. And as all the doctors have said here, you need to keep close track. You need to follow up with that. Do not ignore the signs and symptoms of it, if headaches and vision problems. So that's a very important. That's why we bring this topic up tonight, because we want you to have information about glaucoma. I mean, I don't see it myself in the realm of pediatrics unless they have some type of trauma, as Dr. Isabell said his son did. So, it might be what pediatricians will see, but most of the time it's people that are African-American over 50, diabetic, Hispanic over 50, and family history of glaucoma would be another reason we would think about this. So please, folks, get your eyes checked regularly. When you reach a certain age, everybody should probably have their eyes examined every 2 years. And when you reach a certain age, certain diseases such as diabetes, you should have your eyes checked every year, because the other problems associated with the eye from diabetes and things like that. So please get your eyes examined. I can't stress that enough. Go ahead, Dr. Phillips.
No, I was just going to add to what you were saying, Dr. Boykin, and don't let, especially in the situation of diabetes, the fact that you don't have any visual issues at the moment deter you from getting that regular eye exam, because on a microscopic level, things could be happening before they manifest in a way that you would notice with your vision. So that prevention, again, is of the utmost importance.
Thank you. Go ahead, Dr.
I like to add one. There are different types of glaucoma. For example, the most common is open glaucoma, open angle glaucoma, and that's where there's like a drainage of the fluid. And then there's like angle closure glaucoma, where there's like a blockage. And then there's normal tension glaucoma, where the pressure just gradually build up. But then people have not heard of pigmentary glaucoma. And that's where small pigment granules flake off from the iris part of the eye, and that can affect fluid drainage and cause pressure to rise. So people don't. The doctor can also notice that when they do an exam of, and because they tell you what type. And the thing being in practice, its compliance is very important, because if you don't take your eye drops now, or every day like you should, it'll affect you maybe years from now, 5 years, 10 years, where you can be considered legally blind. I have some patients I know that they cannot drive anymore because their glaucoma was so severe that it affected their vision. And then some say, I wish I was more compliant with my eye drops, and took them like prescribed.
Wow. Yeah, so that, certainly if they're out there driving, they haven't had their eyes examined, they're at risk for causing accidents or different things like that, So speaking of accidents, I want to go ahead and jump into our final topic for tonight. And that's, we need to talk a little bit about donating blood. There is a nationwide shortage of blood. And blood is probably is essential to everything that we do and that we have. We go to surgery, we need to make sure we have. Thank you, Brother Pierce, for putting that up. Save a life, give the gift of blood. But if if you're not available, if you don't know your blood type, you don't donate. So what are you doing to that? So there's some terms people need to understand when we talk about donating blood. And let's see, you need to know if you're a universal donor, a recipient. You heard those terms thrown around pretty frequently. But one thing I tell you, the most important type of blood out there is O negative blood. But unfortunately, only about 7% of the population even produce O negative blood. What do you mean by positive blood and negative blood? Our bodies produce antigens to help our immune system. And what the positive means, you just positive something called rhesus factor. And in negative, you don't have that positivity. But that's what we know. If you receive blood of the right blood type, you won't have an immune reaction, an autoimmune reaction. But suffice it to say that we need blood. Now, I know, Dr. Plummer, you probably deal with people that need blood all the time because you're an OBGYN and a GYN surgeon. So tell us about your aspect of blood donation. Why it's important to you as a physician, and why it's important to people all together?
Definitely, especially in obstetrics. By the time you have a term pregnancy, about 20% of your blood volume goes to the uterus. So after delivery, if your uterus does not clamp down and stop bleeding, it can cause a hemorrhage that I can tell you and witness can be very, very bad. And you can lose, most of your blood volume in a matter of minutes. That's the reason why that when you deliver at home, you're taking a certain risk, because if there's a hemorrhage that happens, it'll take a while before you're able to get to the hospital. And there's so much blood loss and losing so much of your volume that your blood products need to be replaced. And the only thing that carries oxygen to the cells of your body is red blood cell. So they can give you fluids to get your volume up, but the most important oxygen carrying part to your tissues that you need to survive is going to be through red blood cells. So the importance of donation is there, because we need packed red blood cells, because when you donate your blood, they will take the packed red blood cells, they will also take platelets, and they will also take coagulation factors, factors that will help you stop bleeding. And that is the whole component of when you do go end up in a trauma, even if you're not pregnant, that you need to replace your blood volume, you get your packed red blood cells. What also will help stop the bleeding also too, if you don't have clotting factors in there, is also getting transfused clotting factors that were from donated blood. So the whole thing with blood donation is very important. People that can donate blood should donate blood, because we are in a blood shortage, and you don't want, if your family member was bleeding and needed a blood transfusion and didn't have access to blood. So everybody, if you can donate blood, donate blood.
I just want to get this fact in here real quick. Ladies and gentlemen out there, you can thank Dr. Charles Drew, a great Omega man, for discovering this. And he did such pioneer work in blood transfusions and blood banking. So, if it wasn't for his work, he was a surgeon. If it wasn't for his work, we wouldn't know how we would do things at this particular point in time. Matter of fact, there was a lot of argument about what he was doing was not correct, but he turned out to be very correct in what he was doing. So, I do want to go back to blood types again, because you need to know what your blood type is. You don't have to necessarily go and say, "Doctor, give me my blood type," because blood type can be done very quickly. But if you do know your blood type, is an important thing to know, because maybe you're out there, you're involved in trauma, and they say, what's your blood type? I don't know. As a matter of fact, I don't know if you saw the Dr. Ford. I saw on the news tonight that DC is trying to get this thing going where they carry blood as part of their first responders kit. They said the time you get to the scene to the time you go get donation, there's a lot of blood loss. So they're trying to pioneer. I guess they're trying to see how that's going to work out with giving blood out there. But 7% of the population is O negative. That's if they can anybody can receive O negative blood. But the problem is, if you're O negative, you can only get O negative blood. You can't get anybody else's type of blood, only O negative. Now, O positive is the most common blood needed, and about 38% of the population have this particular one. But the thing about O positive, any positive blood type can receive blood type. A positive, B positive, E positive, O positive. 8% of the population has a positive blood type. But again, if it's O positive, you can only receive O positive blood. So that's what's important about knowing your blood type. I don't want to spend a lot of time on that, but I want people to understand that, you have if you don't know your blood type, you might get in a situation. I mean, I have on my medical ID bracelet in my blood type, because something should happen to me and I can't talk. They don't know what my blood type is. You can put your blood type in your smartphone these days. You can have your blood type in there. You can have it in a thing in your wallet. So, I mean, knowing your blood type is important, especially when you want to donate blood. So, Dr. Wingfield, what about in your aspect of what you do? I mean, you're an interventional cardiologist. I mean, what would you say about, and cardiology in general with blood donation? So what would you say about that?
Yeah, thank you. No, it's a big must. It's certainly, we have to increase the awareness in terms of the importance of donating blood, because when you're in that situation, blood is vital. From a cardiac standpoint, I deal a lot with cardiothoracic surgeons. Right now, we have a lot of patients on antiplatelet medications or anticoagulants, so blood thinners. And when you're on a blood thinner, your risk of losing blood is a bit higher, certainly is higher, and your need for blood products certainly goes up. So all hospitals throughout the country, we've tightened our threshold for blood transfusions in an attempt to preserve the blood products that we have. There are multiple measures to avoid wasting of blood products. So when you order blood products, you better need them. So it's certainly vital from a hospital standpoint to have that supply. It's important to increase the awareness for the population to donate blood. But when we talk about heart disease, which is the number one killer throughout the world, and the need for blood products when we deal with open heart surgery, valve surgeries, even heart attacks, there tends to be a need for blood products. So this is certainly something that we should continue to discuss and increase the awareness for.
Are there any contraindications to giving blood? Anybody? Any contraindications that we can't donate blood?
Yeah. So we know that people who have certain infections, someone that has HIV, you can't give blood, or hepatitis B or active hepatitis B or C. Those things can be transmitted through the blood. But I think one of the things that we need to look at is, who can really give blood? Because our chapter, Gamma Pi chapter, we do blood donation at least twice a year at a minimum. And so anyone that's 16 years old, right, they can give blood. Anyone that's over the weight of 110 pounds, they can give blood. Basically, you have to, and you can give blood up to every 2 months, right? You can go and give blood. And you have to feel well that day, right? So you can't go there and you got a fever, you're coughing, you're hacking. But one of the other things, I got a lot of people, even some brothers in the fraternity, hey man, I can't give blood, I have diabetes. No, you can give blood if you have diabetes, right? We know a lot of people have diabetes, but your diabetes has to be under pretty good control. Man, I got high blood pressure, I can't give blood, I take blood pressure. No, you can give blood, right? So one of the myths is figuring out, people don't know they have certain diseases and saying, hey, I can't give blood. No, a lot of times you can give blood. It's only time if you can't give blood if you have high blood pressure. Your blood pressure is way out of control. And I think they mentioned if it's over 100, systolic 180, diastolic over 100. Yeah, you can't give blood like that. But knowing we got to increase the pool of people, right? And let them know, hey, you can give blood. People on blood thinners, you can't give blood if you're on, Coumadin, if you're on some of the other blood thinners, because your blood's not going to clot. So those are the people that really cannot give blood. Let's see, who else? Those are main things. And people on insulin, you can give blood if you're on insulin. I've heard this story several times. Even people in the chapter or people in my office when I try to promote our blood drives. So I know someone else may want to step in on that also, but that was my spiel for that.
I mean, my only thing is anemia is also probably an issue for donating blood. If you have the sickle cell trait, you can still donate blood. I think a lot of it will go for platelets and other blood clotting things, but also they can also filter out some of your red blood cells. So that is also on there. Donating blood during pregnancy probably is not really too much recommended, because they're probably going to end up with anemia usually in the second trimester anyway, just because of the hemodilution of the expansion of plasma volume. But after you're not pregnant and you're healthy and not having any issues, yes, you definitely can donate blood.
Just to add, we covered a lot regarding blood donation for sickle cell disease. About 100,000 people in the United States have sickles, so it affects the African American community. So your blood donations could help alleviate some of these symptoms. So they say if just 1 out of 3 people needed to donate blood, increased in that in the lifetime, that would just, if we increase by 1%, and then that would help alleviate the American shortage of donated blood. And one other thing where you can't donate, if you traveled out of the country, there's a time period you may have to wait for. Thank you.
A good question would be, can you give blood after you had COVID? I didn't think about that before we got on the call tonight, but that's another thing to think about, certain illnesses like COVID. Dr. Ford, I believe it was, said that, you can give blood as young as 16 years of age, but I want people out there to also understand any age can receive blood. And we give blood to newborn babies. We give blood to premature babies. So anybody can receive blood as long as you're typed and matched properly and you don't have a transfusion reaction, or you haven't had a transfusion reaction in the past. There are some people that do require blood transfusion, but we have a way, if they have transfusion reaction, we have a way of pre-medicating them so that they can still receive blood, because blood is a life-saving thing. And the American Red Cross is certainly asking people to please give blood, because we have a shortage. We need O negative blood. So if you O negative, really consider giving it. But if you O positive, please also consider giving blood. But anybody, any blood type can donate blood. And as I think Dr. Ford also said, you can give it every 2 months. People can donate plasma and different things like that. So, blood donation is a very important part of our community, and part of ourselves doing our own work for prevention is by donating blood, because you never know when somebody in our community may need blood, whether it's from trauma, whether it's from surgery, whether it's from anything that need, not born, severely anemic that have to be transfused. I've had kids with blood hemoglobin as low as 6 that had to be transfused because they had some problems with some autoimmune disorders, and they had to be transfused, because those kids can't walk around with a hemoglobin of 6 and expect to survive. So that's why blood donation is very, very important. You don't think about it, the little things like that we take for granted, that blood transfusion will help, and we got to have blood donated to have, because we have to have a pool. Dr. Wingfield said, we have such a shortage of blood now that we have to make sure that when we order a blood transfusion that is indicated, because it's such a shortage of blood out there floating in the pool. So we're getting about that time to the top of the hour. We talked about a lot of things tonight. We talked about cervical cancer prevention. We talked about thyroid disease. We talked about glaucoma, and we just finished talking about blood donation. All very important topics in this our community. Now, I will tell you that it may be some point along in future webinars, we bring some of these subjects back up again, but that's how important they are, particularly donating blood. You notice that every time that we have a webinar, just about at the end, we'll say, please donate blood, because that's critical of a blood shortage in this country. So I'm going to ask the brothers now to consider giving their closing remarks. We'll start with you, Dr. Ford, and we'll move our way up.
All right. Good evening. So I think we definitely talked about a lot of great topics today that really affect our community. The bottom line is you need to go and get checked out by your physician. Go get your eye exam, get screened for glaucoma. Your physician can check your neck and your thyroid gland and do some blood tests to make sure that your thyroid is functioning properly. So these are all things to do. Bottom line is you need to go in and see your physicians, whether it's your ophthalmologist, your primary care physician, or obviously even our specialist. Thank you.
Thank you, Dr. Wood. Dr. Plummer?
Good evening. I always learn something new being around these brothers. I always look forward to all these webinars that we do. And the same thing we've always been talking about is prevention, and also seeing your primary care doctor. We talked about cervical cancer. Cervical cancer can almost 100% be prevented or early detected with pap smears and good follow-up. Also, don't forget about the HPV vaccine, especially when you could vaccinate your early teenagers. That can give a lifelong of prevention. And follow up with your eye doctor regularly so they can get your eye examined. And those were the most important topics we've been hitting all evening. And good night.
Thank you. Dr. Isabell? Sorry.
So the most important thing, physical exams, see a doctor, and they'll just all these preventive measures from cervical cancer, the importance of eye exam to check for glaucoma, even cataracts, and then check your thyroid, because all these work together to keep your body working and functioning. And to add to blood donation, there's only one instance of usually you see a hematologist that maybe you can donate more blood more frequently, and that's somebody who has either primary polycythemia or secondary. That's where your blood is very too thick, because if it's too thick, you can run into problems. These blood donor sites, they love those patients because they can do it sometimes maybe a little bit more frequently. That's the only instance. Thank you.
Thank you.
Have a good evening.
Dr. Wingfield?
Thank you. It's just great to be a part of this conversation, and I really want everyone who is watching to really understand the importance of this and how vital this information is, and really to hear it from us. We're in the trenches every single day, and anytime we can increase awareness, as Dr. Plummer said, he's learning, I'm actually learning. And what we all need to do is really act on this information. Preventative medicine is the way to cure disease or prevent disease. So unbelievable subject matter covered. We covered a lot, and we really just want everyone to act on this. Follow with your or get an appointment with your primary care physician, see your eye specialist. Women need to be screened. We have to talk about vaccines and preventative medicine. It is absolutely vital. So I really applaud this entire group. Look forward to doing it again next month. Okay.
Thank you. All right, 88. Give us your takeout, bruh.
All right. Well, again, I enjoy this tremendously, like everyone has said. I mean, I was rushing my patients out the office so I wouldn't be late, so I can make sure I got a piece of this. But again, as I said earlier, prevention costs us a whole lot less than reaction. And we want you to continue to log in with us on the last Wednesday of the month for our preventive health topics. But also, since it's the beginning of the year and this is the last day of January, again, time to make your appointment for your primary care annual exam. And that is a space where all of these preventive issues can be addressed and a plan of action can be developed. So let's stay ahead of the game, y'all, because catching up makes us the low-hanging fruit. And we saw over the past 3 years with this pandemic, low-hanging fruit doesn't fare well with these viruses and these pandemics that have occurred.
Thank you, Dr. Phillips. Okay, so with that being said, I'll go ahead and take us out, Brother Piercy. I want to thank my brothers for being here tonight. I want to thank the viewers for tuning in as they always do. And just remember, please give blood. Blood is the life fluid for all of us. And I want to thank our district representative, Brother Del Rico Gales. And I want to thank you, the viewers, for being here. And so until next time, stay healthy, take care of yourselves. Don't forget to go and get your primary care exams done, and pay attention to what your body is telling you. Have a very good evening. We'll see you next month.